Welcome to this episode of the Dry Eye and Ocular Surface Disease section of the clinical podcast series brought to you by the American Academy of Optometry Foundation. Today's episode is the efficacy of plasma-rich and growth factors used for stage 1 neurotrophic keratitis. My name is Kaleb Abbott. I'm an optometrist and an assistant professor of ophthalmology at the University of Colorado School of Medicine, and I'm joined by Dr. Sathi Maiti, who is the VP of Research at the Perryman Eye Institute. We are excited to have her join the podcast today and looking forward to reviewing a new treatment option in ocular surface disease. Thank you for joining us.
Thank you for having me.
Can you explain the difference between all of these different blood-derived eye drop treatments? We have autologous serum drops, we have platelet-rich plasma, and then now we're hearing about platelet-rich and growth factors. Can you explain the difference?
Yes, yeah. So these are all biologics or blood-derived products. Our sort of goal with treating a lot of these ocular surface diseases, we're often trying to mimic the natural tears, right? Which we just can't really do with most artificial tears. And so there's a lot of thinking that we're using these blood-derived products in other areas of medicine, and they have a lot of similar property to tears in terms of pH, osmolarity. But in addition to that, they also have a lot of important growth factors, neutrophins, immunoglobulins, cytokines, all kinds of other things that can improve corneal healing. And so there's a few different types. Autologous serum is probably the first one that people became familiar with. And in all of these, the initial procedure for preparation is the same in that blood is drawn directly from the patient in a typical, phlebotomy type of practice. And then under sterile conditions in a laminar hood, that blood is processed. And how they differ is in that processing and basically what components in specific that we're looking to keep. So with autologous serum, the blood is collected into vials and then left to coagulate. There's no anticoagulant, it's left to clot. And then once it's clotted, it's centrifuged. So all of the blood cells, the platelets, everything comes out, and we're left with the serum on top, which is then removed and then typically centrifuged again. At that point, it is sometimes diluted. So some doctors will use anywhere from 20% to 100% autologous serum, and then that is used topically as an eye drop for the patient. This, of course, has the benefit of having a lot of those factors that we mentioned. But one thing that we've started to realize as well is that platelets themselves have a lot of growth factors that could be beneficial for corneal healing. And this autologous serum does not have the platelets in it. In addition to that, some concern with autologous serum is that it may have sort of inflammatory types of cytokines and other things that may actually negate the corneal healing impacts, and that the dilution might have some impact as well. So that's where we're looking at more of these platelet-rich products. So the one thing I think people are most familiar with is PRP, which is platelet-rich plasma. Similarly, the blood is drawn, but this time in the vacuum containers, they have an anticoagulant. So that keeps the platelets from being removed. Similarly, it's centrifuged, but now we've got platelets in that serum. And then, I believe it's centrifuged one more time, and then that platelet-rich part is removed and then dispensed as a topical eye drop. The benefit of that is we have more growth factors with the platelets versus the autologous serum. So PRGF, which is plasma-rich and growth factor, is actually made from PRP. So it's sometimes called activated PRP. So we do that same process with the PRP that we just talked about, but then, we had added an anticoagulant before, which is often sodium citrate. Now in that plasma that we've removed, we add a coagulant, so often calcium chloride. And what this does is it activates the platelets to release growth factors. So the thinking is that now we have more growth factors compared to a standard PRP. I think this is still a very active area, so we're still learning a lot on if that is significantly better than PRP or not. But there's some thinking that it could potentially have even better healing potential than PRP or autologous serum.
I see. Yeah, and we already know that PRGF can work well for stage 2 and stage 3 neurotrophic keratitis, but this study specifically was looking at stage 1 neurotrophic keratitis. So can you elaborate on the purpose of this study and how it was conducted?
Exactly. So, we do know, as you mentioned, that this therapy has been shown to work in stage 2 and 3. But this study in particular was looking at stage 1, which is the most mild stage of NK. So, NK we know is basically most characterized by lack of corneal sensation. And in stage 1, it can often look just like dry eye. There's SPK, there's tear film instability. But if you're not specifically testing corneal sensitivity, you may not know that this is NK. But our concern with NK is that we don't want it to progress to stage 2 or 3. That's where you're getting persistent epithelial defects. You're potentially getting, corneal melting, perforation. So if we can help treat this and take care of it in stage 1 before it ever gets to stage 2 or 3, that is much preferred. And so what this study did is it was a retrospective chart analysis. So they didn't actually initiate treatment in any of the subjects, but they looked back at their charts for 26 eyes from 15 stage 1 NK patients. So for some, they were looking bilaterally and some unilaterally. And they looked at people that had stage 1 NK and had used PRGF drops at least 4 to 6 times a day for at least 2 months. And they were looking at the main outcomes were corneal sensitivity with a Cochet-Binet, tear breakup, Schirmer's. They also looked at corneal staining, MMP9, and best corrected VA. And they actually found that in their subjects, basically improvements in all of those metrics. So specifically the corneal sensitivity increased from 2.8 to 4.5 in over 50% of the subjects. Tear breakup increased, the Schirmer's increased in 80% of subjects, as well as the corneal staining and MMP9. And I think one thing that patients in particular are concerned about is their vision. Vision was also seen to improve in almost 30% of the patients as well.
Wow. So PRGF worked quite well in treating this stage 1 neurotrophic keratitis. Why do you think that this treatment worked so well in NK?
Yeah, one of the great things about this is, often our goal in treating stage 1 NK is we want to improve the epithelial quality, stability, accelerate the corneal healing, and prevent that stromal involvement. And the concentration of growth factors and antimicrobial agents, anti-inflammatory agents in PRGF, it's just doing all of that really well. And in addition, some other studies have shown that these platelet-derived types of eye drops have actually increased corneal subbasal nerve plexus density. So they may actually be contributing also to, healing the nerves themselves. So it's sort of like one-stop shop. It's like taking care of all these things that we want to. And in addition, another thing that the study found was that there were no adverse events. So it's a very safe, tolerable treatment.
So what are the relevant take-home points for our listeners then?
Yeah, I think, this is just letting us know this is another potential treatment on the market. I think many of the time we're a little bit hesitant to get into these more like advanced treatments for milder stages of disease where maybe you're just going to be treating with artificial tears or bandage contact lens. It may actually make sense to consider these blood-derived products, not just in the stage 2 or 3 where things are already heading south, but to hit it really early on before we get more complications. And just, I think we're in a place where we're learning so much more about these products in terms of how to make them the most efficient way, dosing. So I'm sure we will learn about even more specifics of what types of growth factors we want to look for and that kind of thing.
Very neat. Well, a special thanks to Dr. Sathi Maiti for joining us today on the Clinical Podcast Series, and we will see you at the next episode.
Thank you.